you can send in group so I can see hepatitis B surface antigen you said.
Yes, HBsAg positive and anti-HbAc is positive. Rest is normal. Only ALT is little bit higher.
Okay. Core antigen negative.
Core antigen is positive. So
And
anti-HbAc positive. Okay, doctor, give me holding the time. I will be sending that in the group. Okay, give me 1 minute. Okay, doctor, I'll start from zero again, huh? Okay, start again.
you send the report.
Yeah, I'm sending now, doctor. Okay, doctor.
Okay.
Okay, you got it?
Yes.
Okay, start.
Okay. Hello, Mr. Ali. I'm Dr. Radaha. How can I help you today?
Doctor, I just want to discuss this report with you. Can you have a look and tell me what's going on with me?
Sure. Give me 1 minute to see the report. Okay.
Yes, doctor.
Yeah, hepatitis B surface antigen positive, anticore total positive, ALT might elevate. Okay. Mr. Ali, can I ask you some question before to tell you what is in this report?
Sure, doctor, please go ahead.
Okay. Can you tell me why you did this test?
Doctor, this is just like a screening purpose because I need to go to abroad so that my company want to check me before sending there.
Mm, mhm. Okay. Okay, Mr. Ali, do you have any tummy pain?
No, doctor.
Any change in color of skin or eye?
No, doctor.
Okay. Any nausea
No, doctor.
or vomiting?
No, doctor.
Any skin itching?
No, doctor.
Okay, Mr. Ali. Do you have and you don't have any tummy pain?
No, doctor.
Okay, Mr. Ali. Do you have recent travel?
No, doctor.
Mhm. Okay, Mr. Ali. Can I know, do you use any medicine recently
No, doctor.
or in chronic manner?
No, doctor.
Okay. Do you know that you are allergic to anything, including medicine?
No, doctor.
Okay, Mr. Ali. Do you suffer from any liver disease before?
No, doctor.
Okay. Do you have any high blood sugar?
No, doctor.
Um, Anyone in your family have any change color of skin or eye?
No, doctor.
Anyone have any liver problem, any liver nest?
No, doctor.
Mhm. Okay. Mr. Ali, can I know with whom do you live?
Doctor, I'm living with my wife and children.
How things at home?
Everything is good, doctor.
Good to hear that. Do you smoke, Mr. Ali,
No, doctor.
or drink alcohol?
No, doctor.
Mhm. Okay, Mr. Ali, I want to ask you sensitive question. Can I?
Sure, doctor.
Do you have any private relation with anyone other than your wife?
Doctor, currently I am only with my wife.
Mhm. Okay. Do you have any recent surgery
No, doctor.
or you did any dental procedures?
No, doctor.
Uh-huh. Okay, Mr. Ali. Um, Mr. Ali, what do you think may be the cause of this? What do you think may be is going on in this report? What's your idea?
Doctor, I think I'm having some sort of liver problem, but I'm not sure what it is.
Mm, mhm. Okay. And this make you worry or you have any worry?
Yes, doctor, I'm very anxious. I might infect my wife and children if I see I'm having the problem.
Mhm. Okay. And how this worry affecting you in daily life?
Doctor, I can't sleep, and somehow if it is a abnormal report, so I can't I can't go abroad.
Mhm. Okay, I can understand totally your worries. I'm here to help you. You told me earlier that you did this for the job. I can know your job.
Doctor, I am chef.
Uh-huh. Okay. Uh, what about your diet?
That is good, doctor. I'm taking everything.
Uh-huh. That's mean you can you tell me more what exactly you are eating more?
Doctor, as I told you that I'm chef, so I'm taking always vegetables, chicken, mutton, beef, everything at hotel, whatever present.
Mm-hmm. Okay. And do you have any regular exercise?
Doctor, hardly getting time to go.
Mm. Okay, okay, we will come to this later. Let us quick recap our talk. You came today because you have report. You want me to discuss with you. You make it as a checkup in your job, and you worry what's inside this. You think that maybe some liver problem, and you want me to tell you what is in this report. You
Yes,
want any?
doctor.
Okay, 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 Mr. Ali. Let us to tell you, this report is doing as a screening for test called liver function and hepatitis, and that is show hepatitis B surface is positive, and C also is positive, and is mild liver check. That's do you understand what I am telling?
Yes, doctor, but do you think
Yes.
that my liver is not no more with me?
Mhm. No, I'm not mean. This test showing you have infections in the liver, virus infections, and called hepatitis B and
How I
hepatitis
got
C.
it, doctor? How I got it?
Actually, maybe some procedures, maybe some tattoo. You, by the way, you did some tattoo recently.
No, doctor. No, doctor.
Mhm. Okay, these infections is can transmit it to the person by the blood, by injections, by surgery, by needle, and also we can transmit by the sex. Am I clear for you?
Doctor, I wanted to share something with you.
Mm-hmm.
Doctor, before marriage, I had multiple partners.
Mm-hmm.
Is that
Okay,
from that one?
maybe most likely because of that.
Okay, so
Unfortunately.
I infected my wife and my children, doctor.
Right now, let us to screen your wife, and if you have any, because you are chef and you can do the work, you are dealing with the knife. I am afraid that you cut some babies, so let us to screen your wife and screen your children. It's okay.
Okay, doctor. So what you going to do with me, doctor?
Fortunately, this maybe affect your job also because you are dealing with the sharp object. What you think about this?
So I will be getting fired from the work. I will not be able to do the work.
Mm, Let me to write one letter to your manager. If possible, he can change your place, give you in other part in the without dealing with the sharp object until we control your symptoms. It's okay.
Okay, doctor. Okay, doctor.
How about to refer you now to the liver doctors? He will do more investigations and they will
What
screen
he will
you.
do, doctor?
He will start antiviral treatment for you. Okay, and he can
Mhm.
take viral load and he can do other tests for other any disease transmitted by sex or bloodborne. Okay,
Okay, currently you're not doing anything, doctor.
right now it's better to avoid to avoid sharp object. It's better to stop now private relation with your wife. Okay,
Mhm.
and also it's better to eat healthy diet. Try to avoid any fatty meal because it
Mhm.
your liver more. It's okay.
Okay, doctor.
Mhm. Um, any, how about to refer you to Jam Clinic to screen you and your wife for the other sexual transmitted disease, if I can.
So, doctor, if my wife knows this thing, so she will divorce me, doctor.
No, we will not tell her. Actually, we have. She has to know. I will give you a chance to discuss this with her. Okay, and she has to know that because this will affect her, Mr. Ali. Am I clear for you?
I can understand, doctor, but If she came to know that it came from me, then how it will happen?
Don't worry, we will screen her first. Then we can discuss this. We can discuss this for her because this will affect her. Okay.
Okay, okay, doctor.
I want to see you after coming back from a specialist at any time. If you have change in color of your eyes or skin, if you have severe tummy pain, please don't hesitate to come back.
Mm-hmm.
Mhm. Do you want to ask me any other questions, Mr. Ali?
No, doctor, that's it, doctor.
Thank you.
Dr. Zoha, mashallah, you have a very good, thorough, patient-centered approach, very gentle, and most of all, I'm got impressed that you finish your summary till summary, you finish within 5 minutes, which means that, mashallah, you're doing good efforts since many days, and you have good practice, alhamdulillah. Okay,
Thank
doctor,
you. I'm
just
just
wanted
following
to
you.
Thank you, doctor. But let me tell you, doctor, there is one thing I wanted to ask you. As I told you that at the end, mentioned that I'm having I had a multiple sexual partner. So always, doctor, when you're asking about a sexual history, patient will tell you there in the exam hall that currently I'm having one. When he or she using word currently, so you have to say in a past. What about in the past? So patient will
Mhm.
open up. So it will save you a lot of time because from there itself you will be taking your throw and throw management and the thing it will save your time. Okay, so in hepatitis B, most of the time we have to see about talk about risk factors are there. One of the highest risk factor we are talking about sexual history, IV drug use, and household contacts or patient profession and perinatal. If like say patient gone through any procedure, transfusion, or some hospital admission. Okay, family history. We have to open the door to talk about screening family members. Okay, yes.
Uh,
So
Please, one point. I asked him, do you have any private relation with anyone other than your wife? This cannot include the
no, now here
partners.
here Dr. Zoha, this is what trick is there being used by SP. I'm telling you, this is I have gone through multiple this experiments. From there, I learned that SP always they are keeping some trick words, what we call it magical words. If doctor is catching, his or her life will be easier for that case. Okay, so here that he used the word, SP used the word currently. Am I right?
Yes.
Yes, that's the trick.
Yes.
You know that this case is beginning that this is hepatitis B, huh? But the
Yes.
thing that there was a trick. There was a trick that I heard something to know more about you that whether you are aware or not, huh? So other
Mhm.
your case is perfect. There you are competent. Your case is competent. There is no such thing to discuss on that one. But what is happening here? We have to see about one thing that what I am getting from how I am taking this case. Okay, SP will drive you somewhere where you given little bit leverage to that SP will take you out. Okay, so let's talk about the management plan for you to refresh your knowledge. um, this kind of cases examination is not required, so be attentive on that one. And already patient will be showing that LFT reports and hepatitis screening. So what we will be arranging next? First of all, in the primary care, as per WHO protocol, we are going to send this patient to hepatology or infectious disease. Okay. But you should know that what they will do. Patient might ask you. Okay. So you can say that he might repeat your HbSAg after 6 months if there is a first ever positive. So here in exam, there also you can say that this is the first time you have done this report screening. Case might arise like this, Dr. Zoha. No, doctor, this is the second time. What you will do? Huh?
Repeat
So,
now.
yeah. Yes, okay. So they might repeat that one, okay, to based on the chronicity, the patient's chronicity. Okay. And then total anti-HBC or HBsAg and other thing you will be doing. But I'll if not done like say other viral serology, so you can say that they might be doing HIV viral serology like HIV, hepatitis C, okay, and hepatitis A, IgM. Okay,
Mm.
so they will be looking at that one. Okay, but uh, what we will be arranging. Okay, if like say you're going to send this patient, they will be doing lot of things, but in the exam we should not we don't need any exact number. Okay, but we should understand SP might ask you anything. Okay, second, our priority as a GP to explain the diagnosis and natural history in a clear language. Okay, simple language. Number two, address patients transmission prevention and family screening and vaccination. Okay, you clearly did in your management plan. Arrange appropriate investigation and a specialist referral. You did very well. Discuss lifestyle and liver protection. Means like say you're going to talk about diet and patient's lifestyle. If patient having abnormal lifestyle, that as this patient was taking everything, his ALT was raised. Okay, so that is a non-alcoholic fatty liver, huh? And we have to provide psychological support if patient is stressed, having stress, patient thinking, oh doctor, what will happen to my wife? What will happen to my children? So and so. Okay, so these kind of things we have to see. Now, how are you going to explain in simple words? You did very well. So you can say in one way, like say, your test shows that you have been infected with hepatitis B virus at some point. That virus is still present in your blood. Are you getting me, Mr. Khan? Okay, we call this as a chronic hepatitis B infection. Okay, many people with this they live the normal life, but it doesn't mean that we need to look after your liver carefully. It does mean that we have to look your uh, uh, liver health carefully. Okay, like say you can explain. Okay, reassure. This is not your fault. Often this infection occurred in the childhood or through medical or dental exposure if patient is not giving any sexual history. Okay. Number two, you can say, you can reassure in a way there are effective treatment and monitoring strategies are there which will help help you to go with a normal life. Now explain how it is transmitted. So you can explain it is with an unprotected intimacy, sharing the needles and equipment from mother to baby at birth, inadequately sterile medical or dental equipments, or some sort of spa or salon or whatever so on. Not spreading by, you have to reassure it is not spreading by contact, hugging, sharing food, coughing, and sneezing. Okay, he might be having small baby at home. Huh? He said, Doctor, how I cannot hug my baby. I can't share food with my children. I have to eat alone. They might arise, they might come this kind of, concerns. Okay. So you say that you can hug your child, you can share the food at the table, everybody contact at home, everybody, every day contact at home is safe. Okay. He should not be in isolation. Now let's talk about risk to wife and children. Okay. Advise testing and vaccination for wife and both children. One. Number two, if they are not infected and not immune, they should receive HBV. We have to ask them about whether they've received that hepatitis B vaccination course. Okay. So if say yes, then no need. If say "Hey, I'm not sure, then you can say that I'm going to screen it and we are going to vaccinate him. You give him sexual precautions. He say, doctor, I can't avoid. You can say you can use the Barrett methods. Fine. Okay. Now disclosure. This is the important part. Here, I wanted to listen from you something which is bit tricky in a way that how you are going to explain this patient to this patient. Okay, so we have to encourage open discussion with the wife, and if culturally appropriate, to discuss with the family. Okay, because this exam belongs to South Asia, so we have to look into these norms also. Okay, and we have to clarify any legal or occupational reporting need locally. For example, patient comes, doctor, I don't want to discuss this report with my employer because I will lose my job. Okay, but patient taking care of the person he is working as a salon as a barber. He is using sharp items. So he might be threat to the public. Okay, we have to expose. We have to tell that we have to, in a wider interest of public. I am going to. We have to share this thing to your employer. The reason here, patient SP will eat you. Patient SP will be telling you, doctor, no, please, I will lose my job. I will do this thing. You have to explain that you are a carrier. Okay, you are carrying the virus, which is spreading through the needles and sharing needles. For example, like the patient is staff or working with the needles or working where their sharp items are there. We have to expose this patient. We have to tell the patient, okay. But in most clinical examinations, you can say that we will maintain the confidentiality. Only we will share the information with the consent except where public health law mandate otherwise, like say in the UAE. Okay, we have to bar this because we have to explain and we have to we have to explain and we have to inform the ministry and as well employer not to work anymore. Okay, so in the Pakistan and local guidelines you have to follow. Then you have to say that I have to share because this is as a public health law is there. Now, referral investigation, you've gone through very well. I'm pretty happy. Lifestyle modification, if patient is taking alcohol, then to stop the alcohol. If patient taking any kind of medication which is causing liver damage, like the patient is taking for the migraine 4 tablets, might come in agenda that patient is taking migraine tablet, but he is having taking tablet two tablets of paracetamol every 4 hour, 5 hour. We look like it is a medication overusage, overuse headache. Am I right?
Yes.
That patient headache is not getting better. But the hidden agenda was that one patient was a hepatitis B positive. Okay, I was looking at to that one, but I didn't address that patient liver health. Patient is taking 2 tablets of paracetamol, more than 8 to 10 tablets, which is also damaging the liver. Okay, so we have to ask about the medication usage. You very well ask in your history when you're taking history. You ask very well. Okay, if patient say, doctor, I am taking this tablet paracetamol. How often you are taking medicine, doctor? I am getting this bad headache. Almost 6 months now. I am keep on taking this paracetamol tablet every 6 hourly or every 8 hourly, every 4 hourly, whatever, so on. So it means this is the agenda that how you're going to address patient medication overusage, which is harming his health. Already patient is hepatitis B, same time he's taking the paracetamol drug, which is hepatotoxic, and he's taking that double the dose. If patient is obese, then we can talk about healthy weight to cover his fatty liver, which is especially in a non-alcoholic fatty liver. In the in a hepatitis B scenario, mostly the patient always come with the history of ALT race, not AST race, because in our exams they don't make our scenarios more complicated to put as a alcohol, like say AST high. So ALT high means this is a non-alcoholic liver disease. So we can still address that one. Patient is stressful, then you can talk about psychosocial safety netting, red flags. Red flags what? So, sudden jaundice, abdominal swelling, confusion, drowsiness, abdominal pain, and severe illness. As you talk about, you have mentioned in your what you call it in while taking history. You ask
Definitely.
about red flags. Yes, doctor.
Yes.
Okay, doctor. Dr. Grant is
Sir,
there. Yes, doctor.
there's
Fine.
one, one question. Dr. Ran,
Yes, doctor.
okay. If the scenario is just like patient came with a needle stick injury and hepatitis B is positive, so in that case, we have to check the viral load and vaccination status.
Doctor, good thing you mentioned me. I'll tell you there are two scenarios again. In one scenario, it might arise, doctor. I'm working as a staff nurse. As you read in past medicine AKT exam, that if a patient that the staff if he's a staff he don't know about exposure of his about his vaccination, but he got exposed to the person who is a hepatitis B positive. So we have to think about duration when he got needle injury. One, whether he's vaccinated or not. Number two, whether this patient, what you call it, uh, having symptoms or not. Okay. So one scenario. Number two scenario, like this patient will come with a report But he said, Doctor, I am working with as a staff, but I never remember that when I got this needle injury. So duration is unknown. No? So that based on scenario, you can deal, doctor.
Okay.
Sir, one question from my side.
Yes,
Sir,
doctor.
in this case, there will be a breaking bad news because the patient job is compromised. He is want to join as a chef.
Yes.
So this will be a little
Here,
breaking bad news. If he show the concern about his job that he after a long time he will get the job and the financial situation are worse, then in such cases we can go through breaking bad
yeah,
news.
it can be. It will be one scenario. How that Dr. Zoha gone through this scenario. Second scenario, it might arise after asking history of presenting illness. You can say, Mr. Khan, what do you think about your report? Means like they ask the eyes in earlier phase to capture the
Hmm.
scenario, capture the game. Am I right? So there, if
Hmm.
you're asking about eyes and how much you know about this report and how much you
Hmm.
want to know about this report, okay,
Hmm.
there will be give a patient will give you exactly hint, doctor, I want to hide this report. It means patient already know about that this report is hepatitis B positive. So he don't want to
Hmm.
disclose his family or to his employer. Am I
Hmm.
right? So
Yes.
here there are so when you ask the eyes while taking the report, patient, time saving thing is that one ask the eyes earlier. So you will be getting a lot of relief from the thing that you don't have to juggle around here and there. Directly, you will be coming into point that this patient want breaking bad news or patient want confidentiality. You got my point.
Hmm.
So after
Yes,
that,
sir.
you ask about some red flags, ask about some sort of differentials, just like say for namesake, just you ask, okay, and then you come to family history and other things, and after that, you have to mention that. Just give me 1 minute, doctor. So ask about doctor the things where that you have to fulfill all the criteria of that. Even though you know already that this is hepatitis B and this patient want to know about the report, it means this is a partially breaking bad news. But if patient already know about the report and he wants some confidentiality or he wanted to know more about it, it means this is only educational purpose or referral
Hmm.
purpose.
Hmm.
Yes, it,
Yes.
it it is it is applicable everywhere, doctor. Like say if you're getting brass that some breaking bad news or colorectal carcinoma endoscopy report or some sort of sample from what you call it bronchoscopy. You are getting some sort of CT scan report, anything. When you're asking
Hmm.
the eyes in earlier phase, it will save your time.
Hmm.
So here you will
So
be
it
getting
means.
idea. Yeah, there you will be getting. There are three scenarios will come. Either patient is coming from for the report to know about it and treatment. Number two, patient know about the report but want confidentiality. Number three, a patient will be telling about doctor. I know everything. Just tell me the report. Give me the treatment.
Hmm. Hmm.
Yes.
Hmm. Okay. Okay. So ICE is better to ask earlier. You mean to
Yes.
say?
In the report, you have to ask eyes earlier.
Mm-hmm. Okay. Thank you, sir.
Yes, welcome. Dr. Grant is there. Dr. Grant, may I get your introduction, please?
Hello, doctor. Currently I'm at work now, so I just
Okay.
listening. Yes.
Sure, doctor. Sure. Thank you, doctor.
Can I
Thank you.
present?
So,
Thank you.
Dr. Dilip, before you, I will be taking Dr. Sumbal. I haven't got interaction with her.
Sure, sir, sure.
Dr. Sumbal. And what about Dr. Aksa?
Yes, sir.
Okay, Dr. Aksa, ready for the case?
Yes, sir.
Okay, great. So doctors, every Monday we will be having two sessions,
Hello.
and other days we will be getting only one session. Okay. So only Monday we are keeping 2 sessions to fast track. So at least we will be running our show at least 8 to 10 days ahead of our plan. So at least we'll be getting some time, more time for revision. Okay, Doctor, sir, your patient is a Mrs. Sarah Khan. She is a 45 years old female. Come to discuss her report with you. She want to discuss and take the history and manage the patient. Examination is not required. Okay.
Okay, sir. Good
Okay,
morning.
start. Good
Good
morning.
morning. My name is Dr. Aksa. I'm one of the attending physicians here. So, can you confirm your name and age, please?
Doctor, I'm Sarah Khan, 45 years. Yes, doctor. Hello.
Hello.
Yes, Dr. Sarah. Yes, doctor. I'm Doctor. I'm Sarah, 45 years old.
Sorry, can you repeat, sir? There's a net disruption. Okay.
Okay, doctor. I'm Sarah.
Okay. Sarah, so what brings you here today?
Doctor, I just did some blood test for my health. I just wanted to discuss with you. Can you tell me what's going on with me, doctor?
Okay, can you show me your reports, please?
Okay, sent in the group, doctor, holding the time for you. Okay, look at the group.
Okay, sir. Okay. So, Miss Sarah, can you tell me why did you had these reports?
Doctor, I was feeling tired when I was especially in the evening, and I was getting some abdominal discomfort. One of my friends, she's a doctor. She told me to do these reports.
Okay. Anything else would you like to share with me?
Doctor, just I'm feeling all the day tired most of the time. I feel don't want to do work. I don't want to do, kind of laziness,
Okay.
doctor.
Okay. So, do you notice any change of your color, skin color?
No, doctor.
Is there a skin itching also associated?
No, doctor.
Any abdominal pain?
No, doctor.
Do you notice change of color of your stool?
No, doctor, but my right side of my tummy a bit heavy actually.
Okay. And also, do you notice any nausea and vomiting?
No, doctor.
Any fever? And,
No, doctor.
and have you any weight loss?
No, doctor.
So, Miss Sarah, do you have any idea what it says about your reports?
Well, doctor, I think my liver is getting fail.
Okay. And do you have any specific concerns about your reports and health?
I'm worried about my liver will damage. Maybe I need some transplant.
Okay. And what are you hoping today to, how much you want me to discuss these reports?
Doctor, I just wanted to know what is the cause of what happened to me and what is the cause, doctor?
Okay, I would like to ask few more questions in order to explore your illness. Do you get any transfusions of blood or any fluids in your body in the past?
No, no, doctor.
Okay. Have you traveled abroad recently?
No, doctor.
Do you have any tattoo?
No, doctor.
Okay, and I'm going to ask you more personal questions about your sexual history. Are you intimate with someone?
Doctor, I'm married. I have 2 kids.
Okay, and what about the past?
My past, doctor, I had one partner. He was my
Okay,
boyfriend many years ago, doctor.
okay, and anything else would you like to explain me?
No, doctor, what you want to know?
Okay, any other illness, similar illness that you suffered from in the past?
No, doctor.
Do you have any surgeries for your abdomen or anything?
Doctor, I have only 2 cesarean section.
Hmm. And at that time you got confused or not?
No, doctor.
Where did you get the cesarean section? In
In
hospitals?
hospital. Yes.
Okay. Okay. And do you have any liver illness in your which runs in your family?
No, doctor.
What kind of drug you use? Are you using any drug on the regular basis?
Doctor, I'm having this I'm taking the paracetamol because whenever I'm getting headache, I have menstrual migraine, doctor. So whenever I'm
Okay.
getting that time, I'm taking maybe monthly 2 time or 3 time, doctor.
Okay. 2 or 3 times per month. And how much per day?
Doctor, maybe 2 tablets daily or 3 tablets daily, doctor.
Okay. And what do you do for a living?
Doctor, I'm housewife.
Okay. Do you smoke?
No, doctor.
Is everything all right at your home?
Yes, doctor.
Your current partner is healthy?
Yes, doctor.
Okay, Ms. Sara, you are here because of your letharginess and along with some of the reports, and you want me to explain these reports whether it is something sinister or not. Am I right? Or would you like to add
Yes, doctor.
something? Okay, Ms. Sara.
Doctor, I just wanted to know that I'm very fat.
Yes.
My BMI is 32.
Okay.
And I just started one herbal tea bought online actually 3 months ago. But
Okay.
nothing changed in my body, doctor.
Okay. I would like to offer some more few tests and could you do it for me?
Okay, what you want to do?
I also offer some blood CPs, complete blood profiles, and some other hepatitis serologies, and there's also a ultrasound scan of your abdomen. Are you getting me, Miss Sara?
Okay, doctor. What else, doctor?
Meanwhile, I'm also going to discuss some of the lifestyle changes that you told me that you are a very unhealthy person or having a high BMI. So
Okay.
you have to cut down your fatty foods and try to exercise daily. And meanwhile, you also avoid the some of the drug which is also affecting your liver health, like paracetamol. Okay, and you have to also start the some. I'm going to some of your tests also advise that is a fasting lipid profile that will calculate about your cholesterol level in the blood, and also on the basis of this we will start some of the drug which will control your cholesterol in the body that is also affecting your liver too. Are you getting me, Sarah?
Hey, doctor, are you going to do my cholesterol report?
Yes, cholesterol report is also I will do.
Oh,
And
okay.
okay.
Cholesterol report shows triglyceride 395. HDL is 27 only, and LDL is 150.
Okay, 150. Okay, Miss Sarah, I'm going to also refer to liver specialist where he will do some test and further test, and that is that means that he will assess about your liver health, that it was scarring and how much it was affecting, and on the basis of that he will start furthermore medications. Are you getting me, Miss Sarah?
Got it,
And
doctor.
also your report is also showing the some of the virus serology positive. Liver specialist further will evaluate this, and he
Doctor,
will
give me 1 minute,
also
doctor. Give me 1 minute, doctor.
yes.
Okay, doctor, start.
Okay, Ms. Sarah, also going to refer you some liver specialist. He will do further test for your to see whether your liver how much affected by your this high cholesterol levels, and also there's some possibility of viral serology, viruses positive in your blood. So he
No,
will
doctor,
also further.
virus is not positive, but doctor, that is a previous message. This
Okay.
last message was only this one, liver. Okay, go ahead,
E-
doctor.
Okay, and then he will do some other. He will assess about your how much liver was affected because of these medications, and he will further start these drugs.
Okay,
Sarah, in
doctor.
order to see this, I also advise some of the blood tests, including your blood sugars and HbA1c, that will also assess. And How about this? If you check your blood pressure, so also in the daily basis, and meanwhile you have to avoid some fatty foods. I'm going to do also give you a pamphlet about your liver health and about your diet chart. So go and have a read, and if you have any query, you can come back. Okay,
Mm-hmm.
and also I'm going to describe some of the signs. If you notice any changing in your color, any dizziness, any changing in your consciousness level, any abdominal pain, or any intense itching or changing of color your stool, so you will come to the nearby clinic or hospital also. So Bisara, anything else would you like me to explain you?
That's it, doctor. Time up.
Thank
Well
you.
done, Dr. Aksa. Dr. Aksa, you mixed two reports, but I really appreciate that you gone through that viral hepatitis. But actually,
Hmm.
that one message was only that was one message with showing
Hmm.
some LFT report, which was showing
Yes, sir.
ALT was 82 high, AST was
Yes.
raised 60, and GGT was
Yes.
90, and ALP
Yes, sir.
was normal. It is most
Yes.
likely we call it what you call it what you call it this chronic liver, but
Hmm.
because of it we call it normal non-alcoholic fatty liver.
Non-alcoholic fat. Yes.
No.
Yes, okay. Few thing you history is okay, but you have to add few more things in your history. Number one,
Hmm.
when you're taking the history of presenting illness, past history. In the past history, you have to ask, okay,
Hmm.
and you forget to ask about LMP. In the female, LMP again
Hmm.
mandatory part. Okay, if you're missing the LMP, no matter how much you did good job in that case, so still that examiner will mark in that case will be incompetent. Okay, one thing. Number
Hmm.
two, always ask about when you're seeing any one of you, if you see any abnormal LFT report, always ask about any herbal uh, medication usage or some herbal liquid usage, like say some sort of the over the counter they call it liver tonic, okay, to reduce the
Hmm.
fat or whatever so on. So here that you need to ask, and
Hmm.
plus uh, you have to when you are going for addressing patient's concern, sorry, patient's management, so you have to address patient BMI 32. Patient was not taking good diet, okay, and patient was taking a lot of coffee and tea and other thing. We have to address father had a type 2 diabetes, family history was in a way that you have to ask about any chronic illness. Mother had a fatty liver on the ultrasound and hypertension. Uh,
Hmm.
she's a housewife. You ask about the eyes, one of the best things you did. But when you are talking about patient management, that little bit tricky. Okay, so here you
Hmm.
have to tell that I wanted to do few more report to confirm for a few more things. Okay, so like say what
Hmm.
doctor you are going to do it. You did already LFT, so you want to do full blood count, which must would will be normal. Urea electrolyte will be normal. Glucose fasting and HbA1c to see about any metabolic cause and lipid profile. Okay. Hepatitis serology and autoimmune screening, if like say if it is related to the case, you can go for it. And ultrasound liver. Okay. Ultrasound liver is always important when you are seeing any abnormal ALT and AST reports are there. Okay. So now here management plan based on something that we call it what is abnormal LFT means. Okay, we have to tell the pattern from the hepatocellular to the cholestatic. Okay, plus you have to identify likely cause of non-alcoholic fatty liver disease. This patient is not alcoholic and patient is alcoholic, then you can think about alcoholic as per as patient pattern. Okay, explaining that your Mrs. Sarah, that your liver LFTs, sorry, your liver tests are mildly raised. Okay, mainly ALT and AST. Do you know that what is that one? It means that inflammation or stress in your liver cells going on. Okay, it's
Hmm.
not a necessary that failure that you're thinking about. So you're going to address the patient concern. Okay. Number two, doctor, normal bilirubin and albumin INR means your liver function is preserved. Okay. So you have to reassure the patient. Number three, you can say that pattern, like say from raised ALP more than raised ALT more than ALP and ultrasound finding fit with a fatty liver. So most likely if actually there is ultrasound also, doctor. So most likely it is linked to the weight and diet and borderline diabetes. If patient having borderline diabetes is free. Okay, now you can example, you can give like this. Your test shows mild irritation or inflammation or swelling of your liver cells. The good news is that your liver is still working well overall. Number two, doctor, given your weight and blood sugar and cholesterol, for example, as I told you that patient cholesterol is not normal and the scan finding, if like a scan finding given, it fits to the condition which call it fatty liver, which means that excess of fat has built up in your liver. Are you getting me, Mrs. Sarah? Then you can go. This is very common, and in many people, you can reassure that it can be improved with improved or even reversed with the lifestyle changes. Okay, we are going to reassure this is a potentially reversible with a weight loss and metabolic control. Are you getting me, Mrs. Sarah? Then you can talk about patient lifestyle and metabolic management, like say weight loss, 7 to 10% of weight loss. You can talk about in over 6 to 12 months. Like say, for example, some book says that 0.1 to 0.5 to 1 kilo per month, or 7 to 8 kilo roughly you can say. If like say patient having weight of 80 kilo, so you can say over the 6 to 12 months, okay, you have to explain the degree of loss can significantly reduce the fat and improve the LFT. Are you getting, Mrs. Sarah? Then you can think about patient's diet. If patient is taking sugary drinks, you have to stop it, sweets and desserts and refined carbs. Okay. Plus, doctor, fried food and patient is taking, so we have to improve the patient lifestyle and we have to cut down many things and encourage the patient to take more vegetables, salads, and whole grains, pulses and beans, and lean protein like say fish and skinless poultry. Okay. Avoid very restrictive fat diets. Okay. If patient is saying that, doctor, I will cut down everything. No, if patient say that he or she wants some sort of dietitian referral, please don't told them that I will give you. Yes, you can say further I will be referring you to the dietitian. Okay. Before that, we have to give the plan. Okay. Now physical activity 150 minutes per week or 30 minutes per day, blah blah whatever so on that everyone knows about this thing. And medication, if patient is taking some, in this case patient was taking herbal slimming tea, so you can say these are not prescribed. This liver tonics and slimming tea is not prescribed as there is no data about their safety, okay, and their reliability. Are you getting, Mrs. Sarah? So because this was the agenda of the case, then how you are going to address patient the herbal slimming tea, and patient was taking some liver tonic, where to stop. And we have, even the patient was taking the paracetamol within recommended dose, but still you have to tell the patient you should not, exceed that normal dosage of paracetamol. And again, if like say patient is a pre-diabetic or early diabetic changes are there, patient is giving history. So we have to tell that lifestyle can change every your pre-diabetic stage to normal stage. Okay. And regular HbA1c checkup, and consider metformin if he is progressing into diabetes. That is again according to the guidelines. Okay. Lipid profile. Is this patient was high? So you might arise the question, doctor, that what will happen? So we can say that considering, or we can optimize the statin for cardiovascular risk. So here again we have to see the cardiovascular risk. Okay, then we can think about statin drug. And if you give an investigation plan, then you can say that once your report will come back, I will be seeing you. Okay, doctors, any question?
Assalamu alaikum, Dr. Imran.
Yes, doctor.
Yes, I just wanted to ask, because considering the time constraint that usually we have during doing the cases, if instead of explaining the whole diet in detail, if we can only mention that you have to cut down on fatty foods and you have to follow a special diet pattern, it's called Mediterranean diet. How about I give you a leaflet explaining the diet? You can give it a read, and if there are any questions, we can discuss it in the next consultation. So,
Doctor,
yes,
yes, doctor.
yes, so that's all I wanted to ask.
That doctor, that will be wonderful. That will be wonderful. I like that
Dr.
approach.
Imran,
Okay. Yes, doctor.
Doctor, I would like to ask, like during the course of investigation, do we also have to advise like this specialized fibrous markers or fibroscan, or
No,
should be
doctor,
advised by the specialist?
specialist doctor. Fibroscan is the entity of the specialist, not our entity. Okay. Fibroscan again for the alcoholic
Okay,
patient,
okay.
definitely no. Okay. Non-alcoholic, yes.
Mm-hmm.
Yes,
Sir,
doctor.
I have
So,
one
Okay,
more
okay.
question.
yes, doctor, please.
Sir, I read somewhere that if you are suspecting fatty liver disease in any patient in
Uh,
a GP clinic,
uh-huh.
you have to calculate the FIB4 score. It includes just ALT, AST, age of the patient, and platelet count. So you have to
Uh-huh.
mention during exam that I like to calculate your FIB4 score. There's special
That
inbuilt calculators or something. And if it is more than 1.45, you have to refer the patient for ELF testing. And if it is more than 3.25, you have to refer the patient for specialist assessment. So is it
Yes,
like that?
doctor. It will be again. I'll tell you if you guys have time, so you can go through. That is a very good thing. If, like, say, you're remembering during the case, definitely it will be one of the best thing will be there. Okay, so you can explain this patient this to the patient very in a normal way. If, like, say, you're getting this case, but most of the time I'll tell you in the exam again they are going to check your basic things and how you are dealing as a GP. Okay, whatever is not our domain, we will not touch that one, because here again patient might arise, what is this, doctor? So again, this patient is going to take your 1 minute to 2 minutes.
Okay, sir.
Yes, doctor, you can do it. Doctor, what's your good name?
Sir, Dr. Ramisa.
Ramisa, Dr. Ramisa, you are showing Zoom user, so I was a bit,
Sorry, I'll
uh,
change my name.
yeah, please.
I'm going to
Dr.
say
Imran,
Yes, Dr. Mona.
now is if the examiner not give me any ultrasound, just this, I will say this is liver enzyme drained without
Yes, doctor.
no fatty
So,
liver because no ultrasound.
yes. Okay. So what will happen in case, for example, if you're getting this report only that 5 parameters are there. So in that way that I wanted to confirm, I wanted to do few more investigation. Is that okay for you, doctor? For what you want to do? I wanted to check your cholesterol. I wanted to check your full blood count if it is not done before. So you can say that at least you know that what might be the cause. Okay. So to rule out the cause, whether this is metabolic or what. Okay, so yes, you can do the investigation, doctor.
If not give me any result, I will s- bend I will شنو I will wait the result.
No, if, like, say, for example, if you are saying that, doctor, I am going to do see a full blood count, I want to do this thing, that thing. So examiner, if, like, say, there is the agenda of that one, that examiner wanted to test you more, he or she will give you the rating. Am I right? But
Okay.
sometimes they will say exam that reports are pending. Now, if examiner giving you the report finding, then you can talk about, like, say, in this patient cholesterol was high, huh? So in this patient, the examiner wanted to know whether how much you are aware about statin-induced fatty liver. Okay. So here he wanted to say how much safe you are. Am I right? So
Yes.
one. Number two, if patient examiner say that reports are pending, reports are pending means examiner is saving you here that please go ahead to the management plan, that once your till your report come, then we will discuss more on that one. And by meantime, shall we discuss management plan? So management plan based on that, as Dr. Ramisa told, that this Mediterranean diet or DASH diet, whatever so on diets are there, you can talk about. And you can talk a little bit more on that one: patient activity, patient stress level, patient job pattern, whatever. So again, this is an individual based approach. Okay, there is no such thing written hard and fast rule that okay you have to follow this words and this sentences. No, you have to make your own sentences. Doctor, I encountered one of examiner in orientation program. I asked him one question, but that was quite typical question. I mean he answered me. I asked sir, what is your criteria? How do you think that this is going on? This is competent or not competent? How do you think? He said that we are very smart now. We are seeing this uniformity. Okay. For example, he given me one example. I'm just giving you example in a way. Doctor come with a checklist. First doctor came with the same pattern. Second doctor also came with the same pattern. Means this is like say checklist pattern. Here, doctor don't have idea what he's talking and what he's going to talk about. He know that if this thing come, I will ask that thing. If this thing come, because multiple doctors are following their multiple platforms, okay, for the learning purpose. There are many online books are there, online pattern for platforms are there. They are doing wonderful job. But what is happening? Again, we have to learn from those platform and we have to make our own style.
Yes.
Okay, don't forget to make your own words, doctor, please, because they know everything, doctor, more than anyone. But the thing, how to deliver and how to make your words and your styles unique than others, this will make you the position. This will make you to pass. Because, for example, 15 candidates are there in one shift. For example, after 15 candidates, they are following one platform. After 15 for candidates, 6 or 7 following for same pattern. The first candidate who went from that same platform, he or she will be passed. Second will be passed. Third will be plus minus passed. After that, they will start failing them. You know why? Because uniformity is there. Because there is no some sort of core knowledge or basic knowledge. They are following only checklist given by the platform. From there, my candidates are getting failed because they say these are poor in data gathering, poor in managing the patient because they are following the tick list. Okay, tick list is not recommended, doctor. Okay, always make your own sentences, always make your own words. That will make your life more easier and more successful.
Thank you, Dr.
Okay, doctor. And do follow the platforms, do the practice. But when you do practice in between you guys, like say you have two groups or 2 people group or 3 people group, use your own wording, use your own format. Don't follow different same pattern. If you're following the same pattern, it might give you some sort of that time will be giving you that okay, I know this case. But when you're going for the exam, it will be a troublesome for you, doctor, because they are more advanced now. Okay, so doctor, I wanted to take Dr. Dr. Makaram, you are free now. Okay, then Dr. Raj.
Yes, Dr. Imran.
Yes, Dr. Raj, your case is there with me. Okay, your patient is, where is the patient here? Okay, you are seeing one patient, Mr. Qureshi. He's a 42 years old gentleman. Come to discuss his problem with you, take proper, discuss his report with you, take proper history and manage the patient. Examination is not required. I'll be sharing the report in the group, okay?
Okay.
Okay, doctors, and
Shall
one
I
more
start?
thing, just give me 1 minute, doctor. One more thing, doctor, I wanted to clarify over here that whatever that patterns we are sharing with you guys, it is not been copied, it is not get from any paid group, okay? So we are doing from our thing, and there is no resemblance with anyone. Please take note because in the last group we had a big mess with one of the doctor, and it was really big mess. So please take care of that one. We are not doing anything. We are not getting using any paid platform. Yes, I have one paid platform from where I'm taking the videos. When I am sharing the videos, always I'm telling that I'm sharing the video from the platform. I took them took permission, special permission from them, and after that I'm sharing the videos. Okay, doctor, start.
Hello, Mr. Qureshi. Good morning. I'm Dr. Raj, GP today. How may I help you?
Doctor, I just wanted to discuss my reports with you. Can I?
Yes, sir. Yes, Mr. Qureshi, please show me.
Okay, doctor, look into group.
Give me 1 minute so I can see it.
Sure, doctor.
Okay, Mr. Qureshi, before that, I will discuss with you this report. May I ask you a few more questions if you don't mind?
Sure, doctor.
Okay, why did you do this results?
Doctor, I just wanted to know about myself because long time I haven't done the reports.
Okay, so may I know these reports have been advised by any specialist or you have done by your own?
No, doctor, I went to that laboratory and they say this package is going on to know about healthy liver kind of thing. So they did my
Okay,
report, doctor.
okay, Mr. Qureshi, shall I ask you a few more questions?
Sure, doctor.
Okay, Mr. Qureshi, please tell me, do you have any tummy pain,
No, doctor.
any nausea, vomiting?
No, doctor.
Okay, any discoloration of skin,
No, doctor.
any itching?
No, doctor.
Okay, do you have noticed any blood coming in your back passage?
No, doctor.
Anytime you have vomited with the blood?
No, doctor.
Do you feel fatigue?
No, doctor.
Have you noticed any weight loss?
No, doctor.
Any night sweats?
No, doctor.
Okay, have you been having travel recently?
No, doctor.
Okay, have you done any tattoo on the body?
I had a tattoo 15 years ago, doctor.
Okay, may I know the reason why you have done the tattoo?
That time I was in love with my wife.
Okay, so still you have any follow-up with that tattoo? Is this fine, or is there any rash there, any something infection going on there?
No, doctor, it's fine. 15
Okay,
years ago,
do you have
doctor.
okay, Mr. Qureshi, I want to ask you a few more sensitive questions with you. Do you have any private relationship with um, any of one?
No, doctor, I'm just with my wife.
Okay, and do you have any casual relationship other than your wife?
Currently, I don't have anyone.
Okay, so do you have any past medical history of a long-term illness?
No, doctor.
Okay, do you are using any regular medication for
No,
quite long
doctor.
time? Okay, Mr. Qureshi, do you smoke?
Yes, I am smoking.
Okay, how many packs per day?
Doctor, I am taking almost 20 cigarettes daily.
Okay, and since how long, Mr. Qureshi?
10 years, doctor.
10 years. Have you ever thought about quitting smoking, Mr. Qureshi?
No, doctor.
Okay, it has very harmful effects on the body, not only on the lungs and heart, but on everywhere on the body. Okay, so shall we discuss this about in next session? If you agree with this, we can take some plan and date also.
Sure, doctor, we can
Okay,
come on that one.
okay. Mr. Qureshi, do you consume alcohol?
No, doctor.
Do you do regular exercise?
Yes, doctor.
That's great. So, Mr. Qureshi, please tell me that is that be affecting your daily life?
What?
How this been affecting your daily life? Normal going
My
on,
life,
everything?
everything is good, doctor.
Okay. And what do you do for a living?
Doctor, I am, working as a office boy.
Okay. And how's everything at your office?
Going good, doctor.
Okay. And whom do you live with other
Doctor,
than your
I'm living
wife?
with, yeah, my wife and my children.
All everything is fine at your home?
Yes, doctor.
Okay. And what's crossing your mind, Mr. Qureshi? What do you have? Why you bring this report?
Well, doctor, I was reading that something written hepatitis C. I read on Google, it's a really serious problem, doctor. I'm a bit worried
Okay.
about
And
it.
okay, we shall discuss about this point later. So, can you tell me any other specific concern that bothers you?
Doctor, I'm just worried about my children and my wife. Maybe I infected them, doctor.
I can understand that's a very valid concern. So, what do you expect from today's consultation, Mr. Qureshi?
Doctor, can you tell me, can it be cured, doctor?
Okay, Mr. Qureshi, let me summarize that we discussed so far. You have done this report on your own just for to know that what's the condition going on, and you are concerned that it might be affect your children. and this report might be have some problem that can affect your family as well. And you came here for discussion this report. Is that okay?
Yes, doctor. Yes, doctor.
Okay, Mr. Qureshi, I want to do some investigation also other than this, if it's okay with you.
So, doctor, what you want to do?
Okay, I want to do complete blood count, ESR, CRP, as well as ultrasound abdomen. Is that okay with you?
Anything else, doctor?
And fibroscan? Well, we're advised by a specialist basically.
Okay, rest of
PTINR,
the exam.
serum albumin, and PTINR also.
Okay, everything normal. ALT is 96, AST is 82, and previous report you can see.
Okay. Mr. Qureshi, as per history and examination and your lab results, it looked like you have a condition which is called hepatitis C, but this hepatitis C has been resolved. It has its own antibodies. Do you have any idea about it?
Doctor, what do you mean by result, doctor?
Mr. Qureshi, it shows that you have hepatitis C, but you have developed the antibodies against that. Is that okay? And you have little bit of raised your uh, LFTs, liver enzymes, which are most concerning for me. So how about that if I can refer you to the specialist for the most for investigation
Doctor,
purpose?
doctor, do you think, doctor, this is still virus is present in my body?
Mr. Qureshi, let me confirm and reassure you that you have this virus present, but the virus has been tackled by your antibodies that are basically the immune system of yours has been already taken that. So this virus is not active right now, okay?
But I
But
heard,
has been
doctor,
you are
I
immune
heard
with this.
this virus will be killing damaging my liver, but you can see my liver, I don't have any problem.
Currently, this your liver enzymes are raised for this. So how about that if I refer you to the specialist where he going to give you some investigations and some reports as well. Before that, we can comment on this. Is that okay with
What
you?
he will do, doctor?
He will do some ultrasound as well and do some scores to judge that the virus that has been present inside your body is not been damaging much, and you are protected that. Is
Doctor,
that okay with
is it
you?
curable, doctor? Is there any treatment for that one?
Uh, the, the treatment is all available, Mr. Qureshi. I can understand that, but before that, I want to refer you to the specialist where he going to answer you with this. Because other than that, we cannot confirm right now that we should prescribe you any treatment for this because already antibodies has been
No.
developed.
No, just doctor, just can you tell me, doctor, is there any treatment available that my liver will be fine?
Treatment is may I will discuss this treatment plan with the specialist and then I will answer you about this. How about that?
Okay, that's fine. Good, doctor. Sounds good, doctor.
Okay, so if you have any pain, any fever, any weight loss, any skin discoloration, you can notice or feel very fatigued, please show
Mm-hmm.
me to the ER or come to me directly. Is that okay?
Sure, doctor. Sure, doctor.
Meanwhile, I will refer your case to the specialist and discuss with this report and your concern about the treatment plan. If he
Okay.
says anything, then I'll contact you. Okay?
Okay, doctor.
Okay, thank you so much.
Thank you, doctor. Dr. Raj,
Ji.
मेरे भाई, 1, 2, 3, 4. Okay, let's start from the beginning. Okay, wonderful history. A few things I need to get into alignment. Symptoms you asked, red flags you asked, and gone through. Past medical history was shaky actually. He had a jaundice once he was at 15. You have to ask in a way, do you have any liver problem in the past?
Okay.
Okay. Uh, Maybe it was a hepatitis A because it was never documented because when he was in his home country. Okay.
Mm-hmm.
And blood transfusion, doctor. Hepatitis
Okay,
C.
hepatitis.
This is a typical I'll tell you. This is a always remember all of you, doctor. Whenever there's an infectious diseases history or you are suspecting hepatitis, so you have to. These are the most touch points are there. If you are missing anything, you will be feeling they will mark incompetent. Okay.
Okay.
For all of you, doctor, in the past history, past medical history, one. Number two, risk factors for history for this patient, blood transfusion. He received a blood transfusion after road accident when he was 20 years in his home country. Multiple dental procedure done in a private clinic with uncertain sterilization. Then when you ask about tattoo, you have to ask, you did the tattoo, it was in a clean condition or not? No. He was not sure about needle hygiene. Number three,
Okay.
he's not a healthcare worker, but he used to get some sort of minor cut at when he is doing workshop or he is working as an office boy. He used to prepare the tea for others. He used to get the cut, small cut for cutting fruits for others. Means like say, this patient is a high risk for others also. Am I right?
Okay.
Sexual history was done, very good. Drug history was okay. I think you asked. After that, family history, good. Psychosocial doctor was good. I really appreciate. Eyes good. Impact you asked very well. Now most critical part for everyone of you know that exam SP will ask you about something which definitely we are looking at first line, but SP might ask you some second line also, doctor. Okay, so now you have to explain the diagnosis and natural history. One, we have to emphasize the patient's modern treatment is usually oral and highly curative. Now, in this point, I am going to tell you two scenarios, okay? Patient is hepatitis C positive. Patient say, doctor, I don't want to take this interferon.
Okay.
What will happen? You know what will happen? Here, the examiner want to know how advanced you know about the treatment. Okay, you say that this is the good news is that one, there is a modern antiviral tablets. We call it direct acting antiviral or DAAs. Okay, which can cure the infection in the majority of the people usually within 8 to 12 weeks with very few side effects. Are you getting me, Mr. Khan? Okay, you don't have to worry about interferon injection or whatever so on because interferon injection was an old-fashioned thing. Okay, they were long and difficult. Okay, and mostly now replaced with short oral courses of high cure rates. Okay, and the treatment is there. So agenda of the exam can be this one also. Not only explaining the report, it can be because of this one that that examiner want to know how far you know. Okay.
Okay.
Now, yes. Okay. Here when you are
Dr.
explaining the
Imran,
patient, you did
here,
yes, Doctor Raj. Yes, Dr. Snowball.
no, I'm Dr. Snow.
Yes,
Dr.
Dr.
Imran,
Snowball.
here, if patient we put on antivirals for 8 to 6 weeks, 8 to 12 weeks, like 3 months, we should advise about condom also, right? They cannot get pregnant and either male, female, both up to 6 months.
Yes, Doctor, I was coming on to that point. That's wonderful. Thank you,
That
Dr.
is
Snow.
that is in this only, or that is in
No, mostly
hepatitis C virus only, right?
hepatitis C virus only, Doctor.
Okay.
Okay.
Thank
I was
Dr.
coming
Imran,
into
shall we
that.
have to
Yes,
discuss
Doctor.
about the Sopostware and Declessivir? We have to tell this treatment.
What?
Declessivir and
No.
Sopostware.
No. We should tell that,
Ribavirin.
Doctor. No, we tell that I'm going to refer you to the specialist. One thing, okay? Now,
Okay.
what he will do, Doctor, there? Now,
Okay.
now he's asking you. SP is asking from me, Doctor, what he will do. Now here you are going to explain that they are not going to give you injection as you're worried about injection because in the concerned patient is don't want injection. Okay, in
Okay.
IC told he don't want injection. For example, not this scenario, other scenario. I'm creating this scenario from this scenario itself. So in that scenario, you can say, Doctor, Mr. Khan, well, first of all, let me tell you there is a good news that now that old-fashioned injections been replaced by the oral tablets. What do you think about this? Okay.
Okay.
Doctor, how to take it? It will be a treatment for will be 8 to 12 weeks and they're going to treat you. It will be cured. But for that one, I need to refer you to the specialist for further confirmation and to start the medication if it is needed. Now here you should not say that you are going to confirm that he is going to start the medication. Am I right? So here
Okay.
again that the examiner want to say that you should not be judgmental. Okay, here
Okay.
you're going to say that if required, if it is needed, if it is necessary, after doing some necessary test. If you forget, as you did very good job. I really like that approach that he will do, specialist will do. The thing, at least you didn't say anything wrong. You saved that one.
Okay.
Okay, that is wonderful thing. Okay, so
Thank
as
you.
Dr. Sunabo told that even you are going to say that about the medication treatment, so you're going to explain the patient about the safety netting and side effects and other things, what is necessary, what is necessary. Okay, explanation of transmission that you might be thinking that from this patient, you say that Mr. Khan, there are few possibilities are there from where you got infection. One possibility that you had some sort of liver problem in the past. Might be you are carrying that one same. One. Number two, you got road traffic accident 20 years ago. That might be the possibility because you met many injuries over the body and you got treated in the hospital. Number three, you had before the marriage, you had some sort of some other partners. There is a possibility.
Mm.
Okay. Now patient say, doctor, what about my wife and children? No, here, this is the one where you're going to say, uh, what you call it? We can say that
Screen the
how
wife
to,
and
We have to do
sorry, doc.
can we have to screen this wife and children also?
For wife, what we'll do, doctor?
Screening.
husband we
What
will
skill?
do, right?
No, no, what
Husband
test?
and wife we will do.
No, husband already positive.
RNA,
So,
RNA, 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 RNA.
anyone else, doctor?
Antibody.
Yes, HCV antibody, doctor.
HCV HCV RNA qualitative करवाते हैं. We have to do it, no?
No,
Antibody.
no, 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 no. Doctor, again,
RNA,
Dr. Raj,
no? Okay.
I will tell you one thing. Don't say this thing exam because here we call it overutilization of the investigation, the resources. Here you have to say that you will be doing first basic test, which you call antibody, HCV antibody. If
Okay.
negative, we have to consult regarding low but present sexual transmission risk and discuss use of barrier, especially until you are cured.
Okay.
Okay, now about child, what you do?
Uh, no idea.
There will be
We
no
do
risk
like
for the
we do
child as it is not
Antibodies.
one year,
Antibodies.
but it's
sexual, not
Sorry,
yeah, it's
possible.
not
doctor.
sexually transmitted
Okay,
Kids will
doctor.
not be affected.
when
Yeah,
she has.
Okay,
because
now
this
for example, doctor,
إذا
if there is a chance of
ما ضر positive افترضته
yes, yes, doctor, you can do like this. If there is any chance of perinatal or early childhood exposure, like say from the mother, which is not known to HCV positive, risk is low. But still, we have to see the guidelines. Again, I'm telling you guidelines because guidelines vary. Okay. But for example, this patient is a father, no? He's infected. Okay. Routine child testing is not always mandatory, but can be considered if there is a blood exposure. He's saying that, doctor, my child got exposed, and then at the same time, I was also exposed. So we had some sort of blood attachment, something, blood contact was there. Okay. Now, you can say that if you are not sure that you can say that I would seek that specialist advice as Dr. Raj did rightly. Okay. But you have to say, if patient is asking, doctor, is there any vaccination? You can say unlikely the hepatitis B, there is no vaccine for hepatitis so far. Prevention through the avoiding blood-borne exposure. So we have to explain how you have to do it. Like say maybe sharing the needles or injecting equipment, transfusion or medical procedure with unsterile equipment, sharing the razors or toothbrushes if blood is present, and very rarely from the mother to child during the birth. Okay. Now, this kind of cases like say, hepatitis B and hepatitis C, there are many agendas there, right? Many things are there. But again, it is always been derived from the history of the patient, the history of the SP given to the doctor and the doctor's approach. Okay. Number three, I wanted to talk about specialist and referral treatment, doctor. You're going to tell it. You did, Dr. Raj, very good thing. Lifestyle management, smoking, alcohol. I have noted, Doctor, one thing I just wanted to know for everyone. When you guys are asking psychosocial, Doctor, for example, I'm giving one example. How many cigarette you're taking? How many years? Done. Okay. You can, rather than saying that this is addressing over there in a long sentence, which is taking your 4 seconds to 5 seconds, that smoking is dangerous. So have you tried to quit the smoking? He said no. Okay, we will discuss later on that one. Okay, you can say and come out. What will happen here? If you have started going to explain this effects of smoking on his health, it might take you a lot of time. It will eat your time. Okay, so good time management always come with small sentences and short, words. So come out and go to other things rather than explaining the smoking in a 2 or 3 lines or 4 lines. Okay. And drugs and supplement, if patient is taking some sort of herbal supplement or bodybuilding product, if like say bodybuilder is there, you have to say to stop it. Okay. Paracetamol always keep under normal recommended dosage, and he should not use any medication without a doctor's, you know, uh, advice. So, doctor, I left one case, and who is ready?
I'm ready.
Sir, before you can proceed the case, I have the one
Yes,
question.
Yes, Dr. Rubina.
Sir, how much it is important to ask every question, like in this case, if we find that the patient had the tattooing, okay, so we have need to ask every source of the infection. You get my point? If we
Doctor,
find one,
yeah, we find one more thing.
if we find the one cause
Yes,
that the
good question.
patient have done with it, that patient have got from their like the tattooing, then we have need to explore others, or we find the one and then we will go ahead.
Yes, doctor. There is a something what you call it. He got the infection. This is one story, but he's spreading to other. That is another story. He given the blood to his cousin or aunt or his wife, whatever, so on. Huh? One because he
No,
given
sir,
that
my
he.
question,
I
sir,
got
my
it,
question
doctor.
is not that. My question is that if we find in the exam the one source of the infection, like that he get the infection from the tattooing, then we need to ask that you have any dental surgery or any blood transfusion or any accident while you have got the blood. We have need to ask such question, too much question, or when we find the one source of the infection, then we will then stop
No,
there and go ahead.
that is a valid point. But again, patient say, doctor, I did a tattooing. It was sterile clinic and everything was sterile. So again, already we excluded. But if I didn't ask anything about sterility or authenticity, but that then it might raise the question that okay, we have to ask about some other few causes. Okay. But for example, yes, you are right. If you find out one case, it means you become a judgmental doctor. You jump to the diagnosis directly without going to other things. Might be they having some different agenda from the case.
Sir, how we will manage the case, because they are asking the question in
No,
question. Then how
no.
we will complete the history in the 3 minutes or 4 minutes?
Okay.
Then
Okay, let's take the same patient. Okay, let's take the same patient for you. I'm just giving you example. Mr. Khan, may I know, do you have any similar condition in the past, like say some liver problem? Yes, doctor, when I was 15, I got a jaundice. Okay. So inside there was a there is a hepatotoxicity, hepatic event was there in the childhood. Okay. Okay. Now we are going to ask about risk factor. So risk factor specifically about, you have to ask about specifically. This is very important in all cases, doctor. Very important. Again, I'm telling you, because this is infectious disease where you have to talk about any procedure, blood transfusion. Okay. He said, doctor, I did receive blood transfusion. I did a multiple dental procedure. So a doctor wanted, that examiner wanted to know that you want a patient having multiple source of infection might be. So patient is thinking about this one also the thief, that one also the thief, that one also the thief. Huh? So we have to we have to explain patient. You say that you got from blood transfusion. He will say at the end of the session, doctor, I did better procedure also. What do you think about that one? So you will get stuck. Doctor, I got this problem when I was had a road accident. I think I got from that one. But unfortunately, I didn't ask on that point. Okay, so to save me, I just go in one sentence or one line. You can go and you can ask and come out.
Okay. Okay. Got it.
Okay, doctor. Yes.
Thank you.
Thank you, doctor. So, Dr. Ramisa, your patient is Mr. Faisal. He's a
Doctor, sorry,
50.
Dr. Imran,
Yes,
there is
doctor.
no vaccination for hepatitis C, right? But we
Yes,
can
doctor.
offer them vaccination for hepatitis A and hepatitis B virus.
Yes, doctor, we can offer.
Okay, thank you.
Thank you, doctor. Dr. Ramisa, your patient is 50 years old, Mr. Faisal. He's come to discuss some report with you. I'll be sharing in the group, doctor.
Yes, sir.
Okay. So, take proper history and manage the patient. Examination is not required. Okay. Give me 1 minute,
Okay,
doctor. I have
sir.
to take that report from me. Okay. So, Dr. Ramisa, start.
Sir, I did not receive the report yet.
I'll be sharing that, but you have to start first in that what you call it.
Okay, sir.
Introduce yourself and ask about
Okay.
history of presenting illness. Then I will be sharing the report. Okay.
Okay, sir. Okay, sir. Hello,
Yes. Hi, doctor.
I'm Dr. Ramisa, one of the GPs here. Can I confirm your name and age, please?
Doctor, I'm Faisal, 50 years.
Nice to meet you, Mr. Faisal. How can I help you today?
Doctor, I just wanted to show my report. I'm a bit worried about my report to see that is
Mm-hmm.
there something abnormal in my report. Can you tell me what's going on with me?
Yes, please. Can you show me your report? Okay, so this is your report, Mr. Faisal. You are 50 years old and you got this report of your liver enzymes and ultrasound. Okay,
Yes,
Mr.
doctor.
Faisal. So we will discuss about this report in a while. As we are meeting for the first time, may I know why did you get this report done in the first place?
Doctor, I was feeling tired and exhausted all the day. I was getting some sort of, heaviness after eating the food. I went to see one of the GP in my area. He told that I have to do this report. But unfortunately, today, doctor, he's not available. So can you tell me what's going on with me, doctor?
Mr. Faisal, so you told me that you got this report because you were having some heaviness feeling in your stomach and you were feeling tired more than usual. That's all right?
Yes, doctor.
Do you feel sometimes you're having itchiness on your skin?
No, doctor.
Any change in color of your skin?
No, doctor.
Any swelling in your feet or tummy?
No, doctor.
Okay, do you feel you're becoming dizzy?
No, doctor.
What about your appetite? Is there any sudden change in your appetite?
Doctor, I don't have any change in my appetite, but I'm eating well.
Okay, what about your weight? Any sudden weight gain or weight loss?
No, doctor. I'm gaining weight, doctor.
Okay, do you have any idea what might be your weight or BMI right now?
Doctor, my BMI is 37.
Okay, so did you ever try to lose your weight? Do you ever try
Doctor,
anything? Yes.
I am trying this some tablets I got from online. That's it,
Mm-hmm.
doctor.
Are these the herbal tablets?
Yes, doctor. They are saying that there is no such harmful chemical. They are safe to
Mm-hmm.
health. So I'm
Mm-hmm.
taking that one.
Okay. Okay. So, Mr. Faisal, do you have any idea what could be causing your enzyme changes? The
No idea,
changes in
doctor.
this. Okay. Is there anything particularly concerning for you?
Doctor, I just worried about my liver damage. If something gone with my liver damage, so
Mm-hmm.
how I will
Mm-hmm.
be living, doctor?
Okay. And how is your condition affecting your life at work, at home, your social life?
Doctor, I am feeling tired all the time. My job is all the time day standing, and
Mm.
it's really difficult because I'm public relation officer.
Okay, I understand. So, by coming in here, was there anything in particular you wanted me to help you with regarding your job or anything?
No, doctor, just tell me what's going on with me. Is there
Mm.
any cure?
Okay.
My liver is fine or not, doctor?
Okay. So, Mr. Faisal, in order to understand your condition better, I'd like to ask you questions about your general health. Is it okay?
Sure, doctor.
Do you have any long-standing conditions, medical conditions like high blood sugar, high blood cholesterol, or high blood pressure?
Doctor, I'm having high blood pressure also almost 3 years now. Diabetes 2 years now. I have cholesterol also, doctor. I'm taking many medicines, doctor.
Okay, okay, Mr. Faisal. So, did you ever have any surgeries on you?
No, doctor.
Okay. So, what medicines are you taking? Do you have any idea?
Doctor, I'm taking this metformin 1000 twice daily, amlodipine 5 mg, atorvastatin 20 mg, and I'm taking this tablet, doctor, omeprazole, because doctor told I have a condition we call it dyspepsia, and
Mm-hmm.
I'm taking sometimes paracetamol when I'm getting
Mm-hmm.
headache.
Okay. So, how much paracetamol you're taking?
Doctor, monthly, one time or two time, two tablets maybe.
Okay. Okay. And omeprazole, how long you are taking that medicine?
Doctor, omeprazole I'm taking almost now years because my stomach is
Years.
not happy. Yeah.
Mm-hmm. Okay. And atorvastatin, you're taking lipid-lowering medicines. Are you following it with some regular blood tests, like your liver tests, or is
No,
it
doctor,
because of?
it's been started almost 2 years, I told you. Last time I did two
Mm-hmm.
years ago, doctor.
Okay. Okay. And is your blood pressure and sugar in control?
Doctor, my HbA1c last 6 months before it was 7.8, and
Mm-hmm.
fasting sugar I checked today at home, it is showing 125.
Okay. And your blood pressure and cholesterol levels?
Doctor, cholesterol I checked almost long ago, I told you.
Okay. 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 Thank you for giving me this information. So, Mr. Faisal, what do you do for a living?
Doctor, I am a public relation officer.
Okay. And you told me that you have a standing job. All right. And
Yes, doctor.
who lives with you in your home?
Doctor, I'm living with my children and wife.
Okay. Do you smoke?
Yes, doctor.
Ever thought about quitting?
No, doctor.
We will discuss about it at the end of the consultation. Okay. And do you drink alcohol?
No, doctor.
That's very good. And what about diet? What kind of diet you take for a day?
Doctor, I'm eating everything, whatever available. I'm mostly foodie
Mm.
person. I go outside most of the time. I take from mostly fast food.
Mm. Okay, and exercise? Do you do exercise?
No, doctor. I don't go for exercise. We get no time, doctor. I feel tired all the day. As I told you, I'm standing.
Mm-hmm. Okay. So, is there any family history of liver problem in your family?
No, doctor.
Okay. Any family history of diabetes and metabolic syndrome?
No, doctor.
Okay. So, Mr. Faisal, as per the information you have given me, you are feeling more tired than usual. You're feeling heaviness in your upper belly, and your friend suggested and you got this test done, and you are now worried that there might be some liver damage. And you are taking multiple medicines. Your blood pressure is not very much in control, as well as your sugar, and you did not check your cholesterol for a very long time. Is it all, or do you want to add something else?
And that's it, doctor.
Okay, so Mr. Faisal, I think from the information that you have given me and the report that you have shared with me, it shows that the enzymes that your liver produce, they are mildly raised. And the ultrasound shows that your liver is started to get loaded with fat. Are you getting me?
Mm-hmm.
Okay,
Okay,
so
doctor.
there can be many reasons for this, but in as per you, according to the history you have given me, the reason most important, I think, is your weight and your uncontrolled blood pressure, blood sugar, and cholesterol levels. Okay, although also you're taking multiple medicines, like the lipid lowering medicine, you're taking atorvastatin. For this medicine, you have to monitor the liver function test regularly because it can also sometimes cause damage to liver. Are you getting me? And
Okay,
also
doctor.
this medicine you're taking for dyspepsia, omeprazole, sometimes it can also contribute to your condition. So you have to, take this medicine in a controlled way. So what we are going to do is that first of all, I would like to send a few more tests, including a complete blood count to know your platelet levels. And then I'm going to calculate your FIB4 score, which includes ALT, AST, your age, and platelets. And is there any FIB4 score available?
I guess, doctor, lipid profile is fully deranged. It shows triglyceride is 400 and LDL is 150 and HDL is 37.
Okay. So, Mr. Faisal, first of all, we have to stress upon you for complete management of your blood cholesterol levels. We have to increase the dose of your lipid lowering medication after consultation with the specialist because your LFTs are a bit raised, not a lot, but we have to. Before increasing the dose, I have to consult the senior specialist before increasing your atorvastatin dose. Other than that, I would like you to increase the dose of your blood pressure lowering medicine, amlodipine. I like to add some other medicine with it, indapamide. Okay, you have to take it every day along with amlodipine. And for your blood sugar control, uh, metformin, how much you are taking metformin?
1000 twice daily.
Okay, so what we are going to do, first of all, I will offer you some lifestyle modifications. You have to cut down on your sugary intake, and how about you follow a Mediterranean diet? I'll give you a pamphlet for that. You can give it a read, and you can follow that. And
Time up.
okay,
Okay,
a
Dr.
lot left.
Romesa, no, there was a reason to lot left. Let me add on few things.
Okay,
Doctor, first of all, don't use double-barrel questions.
okay, okay,
Okay,
got it.
one thing. Because in previous case, first time I did that you also there was a double-barrel question. Second thing, using the medical jargons.
Okay,
Okay, number three, summary should not be too long. Your time taken in the summary. Your summary,
okay,
it must be like this, Mr. Khan. You come to discuss your liver function report. After being discussed with, as per consideration, as per advice by the doctor, and so you're worried about that it might be damaging your liver. Is that anything else you want to add? Okay, so
okay,
here you took one part from the concern and one
okay,
part from the HPI, and you
okay,
summarize the patient. Okay, here you took 7 seconds, less than 7 seconds. Okay, but in your
okay.
summary, you took almost 1 minute, doctor.
Okay, got it.
Okay, so that was the reason you got short in time while managing the case. Otherwise, there is no such thing left from your side, and you explained very well that fifth score. That is, in this case, it was required to know about it.
Okay,
Okay, and that's it from my side, doctor. I have to rush for my duty. So see you guys in evening with new, topics, and the new candidates will be there.
okay. Thank you so
That's it
much,
from
sir.
my side. Okay. So tomorrow, inshallah, there will be afternoon session.
Okay,
Okay.
sir. Thank
Thank
you.
you very much, doctor. And day after tomorrow, again, morning after. So tomorrow there will be evening session, and day after tomorrow there will be afternoon session. Okay. Thank you very much, doctors. Thank you.